Is somebody working on the, let's say, early indications, let's say, of irregular activities like that in the heart? There are lots of other, treatments out there, but getting an early, like, pulse and radar on somebody who's going to have that reaction, is there much available in that space? Or
you're talking about Minority Report with Tom Cruise and precognition, which is early detection.
Yes.
And I think the ideal state is to be able to pick something up that's a warning signal.
Yes.
And if you think about Apple Watches and our Garmin watch, it doesn't have to be that specific brand, but Apple Watch really was probably an innovator in being able to detect atrial fibrillation. And that's huge, that a personal wearable that's also fashionable can actually potentially save your life. And we've had patients come to us that because of their watch said, hey, I detected atrial fibrillation, which is an erratic, a vibratory rhythm from the upper chamber of the heart that can increase the risk of stroke. So by detecting that arrhythmia, you could prevent a stroke down the road. There's still a lot of progress that we need to make in terms of predicting who might die suddenly, because there might be features of warning signs and say, how come we didn't know? But some of this, the reason it's called sudden cardiac death is that it's not predictable, which is the challenge.
Right. I mean, I imagine by now somebody's gathering all this data and feeding a lot of it into a location so that AI can do simultaneous analysis of millions and millions of inputs. Do you think that in our lifetime we'll get that? We'll make enough progress on that to get predictive?
I think so. I think we'll make progress, but we'll never be 100% predictive. Even when you look at AI, the area under the curve, which is its predictive accuracy, these are usually about 80% or 90%. So we'll never hit it out of the park and say we know every one. And it's really hard to predict a heart attack. A heart attack is essentially when the artery gets blocked off the blood flow because a little piece of cholesterol plaque gets inflamed and it ruptures. And then when it ruptures in the artery, there's a blood clot that then forms and then blocks off all the blood flow. Right. Then the muscle that it's supplying dies. That is something that we wish we could predict if someone's going to get a heart attack. Why does someone get a heart attack at 6:07 when they've been eating McDonald's hamburgers and cheeseburgers for 30 or 40 years? And if there's this criticality that occurs in all of healthcare, which is like, how come someone's healthy and then all of a sudden sick? But I think earlier recognition, prevention, is something that we have not emphasized enough as a healthcare system. And biometrics, wearables, they actually increase the collective consciousness, I think, of healthcare, which is great.
Oh, yeah. And it ties it to the general public in a way they can understand it, right?
Exactly.
That's so critical to the
glucose sensors, right? I've experimented with a glucose sensor, just seeing what my body's reaction to food is. And you think about how it's typically used for diabetics, but what a breakthrough to be able to see what your body's chemistry and how it reacts to different foods.
Yes.
And I was able to find that you can actually hide pasta in the carbohydrate spike of insulin if you have a ribeye before it. So food order matters.
Yes.
There's just different things that we need to rethink, but having a lot of biometric and wearable data at our fingertips is a huge advance.
For more information on the innovations shaping our world, visit tomorrowsworldtoday.com, check out the Tomorrow's World Today Facebook and Instagram pages, or subscribe to our YouTube channel.